Hi, my name's Abigail Bennett, and this is my week 5 discussion. So, just to talk about some weight stigma and food bias that I've seen whenever I've been in my previous SELs. Sorry, that's my cat scratching. He just does it at random times. But, anyways, so I've noticed it a lot in my clinical SEL experience. So I was working with this one registered dietitian, and she actually doesn't work at the hospital anymore. But when I worked with her, she would really emphasize a person's health status and how it correlated to their weight status. And that was like the first thing she would always mention, no matter what. And that person could have plenty of other medical diagnoses, and she would still focus on like the weight. So that was something I didn't really like. And then there was a time when another healthcare professional was speaking with the RD that I was shadowing, but they were speaking about a patient's drug use history and how that patient was so underweight. And I just felt like it was a very unprofessional experience that I've had just watching that. So that was really upsetting as well. And then assuming anyone who is overweight wants weight loss advice, I think when I've shadowed some of the dietitians at the hospital, you'll see them assume that people, always want weight loss advice, when I've noticed that most people who are overweight already have heard the advice or they see it, and they most of the time don't want to hear it again, I've noticed. So unless they need the education, I think it's important to understand that you don't always need to keep giving them advice, because it kind of just does reiterate the fact that they need to lose the weight, and it keeps putting that pressure on them and, all the other things that come with that. So whenever I did the weight bias 2-part little activity, I really enjoyed the material. I thought it was very educational. I liked, they used a lot of graphs and charts, which is good. The visuals were to kind of help you put in perspective just how serious this issue is, especially with, adolescents and kids. But when I did the quizzes, so the first quiz I got a 4 out of 5, so an 80, and the second one I also got an 80. I tried to take pictures of the quiz like at the end to keep my score, and I guess my phone's storage is too full, so I didn't save it. So I can't tell you which ones I messed up on, but I remember when I was going through it and reviewing the answers, they were just like little things that, could easily be missed, but nothing too crazy. And then when I listened to the podcast, a couple things that were interesting to me is how it is assumed that underserved areas are unhealthy or overweight because of how the culture eats or the lack of access to grocery stores, and when this is just not the truth. I think it's like really common to think that way, because I sometimes think that way as well. I live in an area where we have a huge Hispanic population, like almost 40% of the county is Hispanic. And it's easy to think that, oh, well, maybe they eat that way because the culture eats a lot of this or a lot of that. But you don't think about the fact that maybe they just don't have, certain other things that, certain groups are given. You never know the truth until you, I guess, get into it more. And then the lack of access to resources that would keep someone healthy that others may have access to. So that was spoken about a lot in the podcast. And I guess I've really never thought about that. I guess because I'm white, so I was raised in different areas, and like I was given access to pretty much everything I needed. So I didn't think about the fact that other people aren't always given access to this. I know that seems awful, but you assume, oh, they go to public school, so they have this and that, and they get, all these other opportunities, but it's just simply not the case, unfortunately. And then another thing that I thought was very interesting from the podcast was the $339 million VERB program that only resulted in a 6% difference, and how it was so emphasized and popularized. I thought that was wild. And then the girl who was speaking spoke about how it was kind of a constant reinforcement of body weight on young kids, especially on herself. And then another thing that I made note of in that podcast was just the amount of money wasted. So when the dietitian shared the story about she worked at a hospital, and there was another dietitian that said, we got to spend so much money, so we're just going to buy these diet books. And the dietitian was thinking, this is so counterproductive. Like, we could spend it on such, other resources that would be much better for our patients. So it's just interested the money that just goes to things that aren't even helpful. I thought that was honestly concerning. And then these are some questions I wanted to add to my MI focus questions, these to address shame or weight bias. So what experiences around weight have you experienced in the past or right now? How does this affect you? Can you share a time when your doctor put an emphasis on weight? How did this make you feel? And then how does others' perceptions of your body affect how you view yourself? I think all of these questions can really give the dietitian like more insight into what that person's experienced. And it kind of does allow for the patient to be a little vulnerable. So when I ask these questions, I would expect that sometimes, they might not always be the most appropriate to ask with everybody. And then also to adjust them, based on each individual. If they're not appropriate, make the conversation a little more comfortable for that patient instead of asking such, triggering questions possibly. But these are the questions I would want to ask if I felt comfortable enough with that patient. Then my resources, and that's it. Thank you so much.